And gentlemen, it is my greatest pleasure and honor to welcome you all to this National Audit Office press briefing. As you all know, on Monday, the 17th of May 2021, our office was awarded the 2020 Best Prize for Performance Audit by the African Organization of Supreme Audit Institutions, English speaking, for our latest performance report on emergency obstetric care by the Ministry of Health of the Gambia.
The National Audit Office was established under the Section 159, subsection 1 of the Constitution of the Republic of the Gambia as the Supreme Audit Institution to assist the Auditor General in the performance of the functions conferred on him by the Constitution or any act of National Assembly.
African Organization of Supreme Audit Institutions, popularly known as AFROSAI-E, is the English language subgroup of African Organization of Supreme Audit Institutions, the African branch of the International Organization of Supreme Audit Institutions. AFROSAI-E was established on 1st January 2005 after existing as an informal organization since its inception in 1998, and the Gambia is one of the founding fathers of the organization. It currently consists of 24 English and 2 Portuguese-speaking Supreme Audit institutions. Press members and partners, as an independent assurance provider for the public, the National Audit Office continues to strive for relevance and better service delivery. We are a member of several international bodies and regularly engages various stakeholders to foster collaboration with other Supreme Audit institutions, increase our capacity, and boost audit impact through lessons and experience.
The office won a prize for the 2020 Best Performance Report in the African English-speaking Supreme Audit Institution's Vision. The report is on Emergency Obstetric Care 2019.
Performance audit is an independent assessment or examination of the extent to which an organization, program, or scheme operates economically, efficiently, and effectively. It goes beyond the judgments of compliance and accuracy to also evaluate performance and the value for money obtained in government transactions.
It is a constitutional mandate for the Auditor General to carry out performance audit. This is enshrined in Section 160, subsection 2 of the 1997 Constitution of the Gambia, which states as follows. I quote, "In the exercise of his or her functions under this Constitution or any other law, the Auditor General shall at all times carry out economic, efficient, and effective examination to satisfy himself or herself that public funds are spent in such a manner as to reduce waste, eliminate inefficiency, and maximize the benefit to be gained from the use of the resources."
This report relates to maternal and child health. According to the National Audit Office, maternal health in the Gambia is one of the key components for equitable provision of quality health care to the citizenry, which has attracted both national and international attention.
For functionality of EMOC centers, the Gambia meets the acceptable level of comprehensive EMOC centers in terms of number, but there are still gaps as to the distribution of these centers. Lower River Region and North Bank Region West have no facility providing full set of comprehensive EMOC functions. Recommended number of functioning basic EMOC centers as per the WHO recommendation is not met in the country. Blood transfusion services is not performed in 29% of the designated comprehensive EMOC centers due to the unavailability of blood bank facilities. Cesarean section is not provided in half of the mandated comprehensive EMOC facilities due to lack of human capacity. For 2 of the facilities visited, there were theaters with necessary equipment, but there were no qualified personnel to deliver this service. Most of the facilities visited fail to operate as basic EMOC centers due to non-performance of assisted vaginal delivery. 95% of the 22 health facilities that did not provide assisted vaginal delivery in the last 3 months did not have vacuum equipment and human capacity to carry out.
The report was submitted to the National Assembly in December 2020 after 7 reports have been submitted, but none of them have been discussed.
I'll digress a little bit. We have submitted a number of reports. This report was submitted, particularly this one, to the National Assembly in December of 2020. But they are yet to discuss it. They haven't discussed it at all. We went ahead, of course, and published, having considered the possibility of non-discussion at all by the National Assembly, because we have previously submitted about 7 or so reports to them that have never been discussed at all. So the chance of this report being discussed is very minimal, so we decided to go ahead and do the publication.
The challenges faced during the time this performance audit report was being made was access to information.
Another important challenge is the responding to audit queries. Many a times audit entities or auditors fail to respond to our audit questions or our audit queries, which would indeed really take something out of the report, because it fails to avail the citizens as reasons why the findings of the audit report are highlighted. And that leads sometimes for us to meet key officials in this auditors. Due to sometimes most of them are not very well knowledgeable when it comes to performance audit. Sometimes also due to the busy schedule. I think the way forward here to remedy these challenges, one would be to urge the National Assembly to discuss this performance audit reports.
There have been follow-ups made according to Mr. Baba Drame, Director of Audit Performance Unit.
Including the National Assembly, to sensitize them about the implementation, the implementation of the audit recommendation, the importance of discussion and implementation of the recommendation. And this is something we have as part of our strategic priorities to still continue to engage the National Assembly on this. Apart from that, I don't think there is anything else that we could do. Unless the media and the stakeholders out there, the CSOs also help. Because if they follow up these audits with the National Assembly, I think they will be able to push the National Assembly also to discuss the reports.
Yes, talking about the follow-ups, you mentioned waiting for 2 years.
Yes.
Yes. Can we understand why the long wait?
Yeah, because as you can see from the report, it covers the entire country. So in order to give them enough time to implement the recommendation, it cannot just be 1 year, because they also have to liaise with the other health facilities to be able to implement the recommendation. So as per our standards, because we are also operating according to international standard of Supreme Audit Institutions, the requirement is to give a reasonable time for auditors to be able to implement your recommendation. So if National Assembly had discussed our report, they would have pushed the auditors to implement quick enough than they are currently doing. So this is the situation.
The next report of the National Audit Office will be on cargo handling by the Ports Authority. For Sahel Network News, Aja Kadisanya.